Hi there, everybody. Welcome. I am Jessica Mcilveen, founder of Kids Yoga Therapy. And as some of you might know, I've been conducting interviews over the last few months of people that have really amazing journeys and stories to share, but also professionals that work in the field similar to mine. So these could be people that have had quite complex and traumatic childhood experiences or experiences when they've been adults, and they've really been able to find what works for them through the yoga practice and through meditation practice and through the body work that they've done. And then also when I'm speaking to professionals, I'm really trying to, I guess, give insights into what they've seen amongst all of the children that they've worked with. So my intention with these series of interviews is to bring the language to the experiences of children, the sensations they feel, the feelings they have, the behaviours that they are, sharing. Because unless we have language to explain it, because we are language driven as adults for our communication for the most part, then we actually have a pretty slim chance of understanding our children. And if we don't understand our children and what they're experiencing, then very rarely can we meet their need and meet them where they're at. And if we can't meet them where they're at, then there will be no change. It's really as simple as that. So today I have the amazing Stacey Louise here with me. Now, Stacey is a registered children's yoga teacher, a children's yoga teacher trainer and yoga therapist. And Stacey has an amazing array of skills and work that she's doing with children around Australia and internationally as well, which she will share. So first of all, Stacey, thank you so much for joining me this morning.
Thank you, Jessica. I'm so happy that we were able to sync up.
Yes, me too. So we tried last week, everybody, and it just did not work. IT really was my friend. So this week it's come together beautifully. So Stacey, I'd love for you to share a bit about yourself, your background, and I guess just to give people a sense of the person that you are.
Sure. Well, thank you so much for inviting me and sharing with your community. I have been working with children for as long as I can remember. I actually started off as a primary school teacher. I didn't finish that degree. It was one of my prac teaching classes where I had this overwhelming feeling of like, this isn't it. And it was pretty shattering because my whole childhood I knew I was going to be a teacher.
Yeah.
So I left that degree, took a bit of time off, did a second degree in a Bachelor of Communication, and that was majoring in drama and screen production with the intention to work in children's television to create a well-being program for children so that when they're watching TV, they could actually participate and do something that was going to be good for their well-being. So I managed to get into children's television. I worked at Network 10 for 5 years, and I worked in the children's TV department there, and I loved that work. It was super creative and fun. There were other elements that weren't aligned for me, and so there was still this feeling of like, this isn't it. Okay. Which again was pretty devastating because I'd invested a lot of time and money and energy into that pathway. But all the while I was practicing yoga for my own health and my own sanity to be able to deal with that industry. And I remember one of those meetings you have with your managers, and they say, what do you do with your spare time and where do you want to be in the company? And what came out of that meeting was revealed that I really love well-being and fitness and relaxation and helping people to feel good. And so he said to me, why aren't you doing that? And it was just one of those
people. I love those people that really shine a spotlight. Yeah.
And so when they said, what are you thinking about with your future in this company? And I said, I don't see myself here in the future. And I said, did I just resign? And they were like, kind of. So I literally had 12 weeks to start my own business because that was the date that I'd given them. It was all very much I felt like I had these divine hands kind of pushing me.
Yeah.
So I started my first business, which was children's fitness and children's yoga, and that was back in 2005. So yoga wasn't as mainstream as what it is now, and certainly children's yoga was a very new concept. But at the time, children's fitness was quite a focus point with an obesity epidemic that was being reported at the time. So I managed to be able to get into a lot of schools, and my first work in the hospital at Royal Children's Hospital in Brisbane. I worked in the mental health ward there, teaching a blend of fitness and yoga to the children in that ward.
Okay.
And then it was after that, another 5 or so years that I focused more solely on yoga. And so I've been teaching children's yoga right from 2005, but really exclusively for the last sort of 12 or so years, just honing in on yoga.
Yeah, perfect. And for you, Stacey, why? You know, what do you see as the benefits? What do you see as important with this work that you're doing?
I think more and more children are growing up in a very busy world, in a digital world as well, where their attention is constantly diverted and taken off to different areas. So I find one thing is what I've noticed over the last decade of working in schools and in hospitals is children have higher levels of anxiety now. They're having less ability to focus on one thing at a time. I find their attention span is a lot shorter. I find a lot of children are more overstimulated, whether that's through technology and devices or whether that's through their diet. Finding there's a lot more diagnosis of children on the spectrum and with ADHD and maybe some other learning or sensory processing disorders as well. So there's a higher prevalence of children that are needing some extra support in the classroom or in their life. So I find that with children's yoga, it gives them a chance, because a lot of it is play-based. It's a great therapy that is play-based. So we're meeting them where they're at, we're doing something engaging and fun, and yet the tools and techniques are woven into that play-based activity. And there's a really big focus on movement so that they can get their body healthy and stimulated in a balanced way. But then there's also this component of relaxation. And it's in that breathing and that relaxation where the real gold is. That's where we can help them shift from that fight-flight response into that calm response of their nervous system. So for me, that's really where it's at. And a lot of the games and the movements are all about getting them to that still place, so they can get all their fidgets out of the way, and so that they can be really ready to be still.
Yeah, perfect. And so I just wanted to touch on the work that you're doing within the hospital, because medical trauma tends to get missed a little bit when we speak about trauma. And I've definitely had parents contact me and work with me based on medical trauma, but it's not mentioned very often. So in the work that you're doing within the hospitals, what do you see as working for these children? And is there a difference between these children and the other children that you see out in the community and other types of needs and trauma?
Yeah, thank you for recognising that, because I do feel like it is, like you said, not really spoken about, and there are a lot of children that are really finding a challenge in processing their experience from the medical world. And I think as well, it's starting to come more to the forefront now, and I definitely am hearing from more medical professionals that they are noticing the anxiety levels in children are elevated, and they're not sure what to do, and they're not sure how they can still go about doing their job, giving them the procedures that they need and helping to de-escalate that anxiety. So I definitely do notice a difference with children, particularly patients that have repeat treatments, ongoing treatments. For example, diabetic patients, they might then develop a needle phobia from their constant insulin injections and needle pricks. Obviously, children getting chemotherapy, long-term trauma there. So a lot of the things that I notice is they're in that constant fight-flight mode. And sometimes it's still at a low level or a low grade, but it's always there, humming in the background. And what I find is the greatest result for these children is getting them really present, again, really present moments. So using a lot of sensory work where they're noticing where they are right here, right now, not where they were yesterday, not where they might be next week, but how they're feeling in their bodies right now.
Yeah.
Obviously doing a lot of breath work with those children so that, again, we can get that vagus nerve stimulation so that they can switch back into their parasympathetic nervous system, or in lay terms, their calm system. And a really big thing that I think gets missed a lot with these kids is acknowledgement. Acknowledging what they are experiencing or what they have experienced. And I find that because sometimes adults don't have the tools with how to process this, it gets brushed off and minimized. And so the children then have these really big feelings that are being asked to be brushed over or pushed down or sugar-coated with a treat or some other reward at the end of their treatment to try and forget about it.
Sure.
And so a lot of the work that I do will be giving them a safe space to talk about their feelings around their treatment. And that, I think, in itself, a huge part of the healing.
Yeah, absolutely. And I guess, because with what I've experienced in the trauma world, it's only just becoming realised how important it is to work with the body. And when we've got, generations of parents, and that's a really foreign concept. It's really very confusing to think how the body could be just as or more powerful than the brain. We are so, we're very conditioned to constantly think our way through things and think our way into a solution and think our way out of problems, all of these things. However, when we've got these fears and, as you say, the fight flight, that's all in the body, and it's that these children are running from and it hasn't been acknowledged. And that's quite often, you're right, the parents don't really know how to do that for themselves, and then they don't know how to do it for their children. So in your experience, because we say that the fight flight comes in, so how does that show up in a child? Like, what exactly do you see physically or behaviourally with children that are just in this mode?
Yeah, great question. So obviously the phrase fight flight gives us a bit of an indication of what we might see. So they might go into that flight mode. So there's that they want to run physically away and try and get out of the room or the experience that they're in. If they know that they can't run away, there might then be the leg shaking or their hands shaking. So there's that energy built up of I need to run, I need to run, I need to run. And even if the physical body isn't going through those tremors, then there's definitely an internal tremor. So there's an anxiety that's running up and down their body. And that's often seen by their eyes darting around and fidgeting, maybe unable to focus on language. So maybe not being able to have a coherent sentence or saying things that don't quite make sense. And then we might have the fight response, where a child literally can get aggressive and their language starts to get quite aggressive towards their parents or towards medical staff. They might physically get aggressive and start pushing people away. Definitely when I've been in treatment rooms when children are getting a procedure done, if they've reached that point, there will be physical contact where a child is kicking or pushing, screaming, biting. It's that real animalistic response to that part of the nervous system, that reptilian part of the brain that is really just in survival mode. And then, of course, you might have a child who's completely numbing and frozen and detached from the experience. So they're sometimes fetal position or curled up. They don't want to make eye contact. They don't have responses. There might be a shrug of the shoulder or I don't know, and just a real numbing pattern. Perfect explanation. It gives a really good visual, all of those things. And so what would be your first steps working with children like this, and children of all
you know, shapes and sizes, so to speak. So when you're wanting to work therapeutically with them and work with the relaxation response and really get them present with their body, get them to reconnect with their body, what tends to be the go-to approaches for you, or your favourite approaches, or the approaches you see to be most successful for the children?
I'm a really big fan of the work of Dr. Dan Siegel and Tina Bryson in the book The Whole Brain Child. And in that book, they explain we need to connect with the child right brain to right brain, so emotionally connect with them. So mirroring tone of voice where appropriate, facial expressions, body language, so that we can actually form a connection with the child first. And I feel that's first and foremost, and that's the first step that often gets missed.
Yeah.
So a lot of adults are very quick to just jump into the logic and try and, like you said, talk from the brain and try and work from the top down and try and explain why we need this procedure or why this behaviour is not appropriate in this place, or use your calm words, or make good choices. And all of that is actually just inaccessible to the children at this point in time.
Yeah.
So I think the very first step is matching where they're at, meeting the child where they're at. So there is a connection then between you and the child. And then from there, we can work into a calming technique. And from there, once calm, once we've got all of the brain wired back in again, then we can come back into the logic and make good choices and go from there.
Yeah, that's right, exactly. And so would that be a case of doing movement and then going into breathing? How do you structure your classes so that you can get the children to the calm space that they really need?
The first thing I do is definitely mirror where they're at. So when I'm first walking into a ward at the hospital, I'm not just coming in like, oh, bright and happy and, you know, dressed up and like, hi, everyone, because that may not be where they're at. And so there's not going to be an energetic match.
Yeah.
So I'm coming in quite neutral. And the first thing I'm doing is seeking out where they're at and matching that energy. Yeah. And then finding an activity that's going to engage them. So it could be a craft activity, could be something very simple, but something that's hands-on that allows us just to chat about nothing high pressured, to build rapport and trust. Once that's been built, then yes, a little bit of movement to get the body releasing some of that tension, and then shifting into breath work and then a guided relaxation at the end.
Yeah, perfect. And so what have been some, have you gotten feedback from children, you know, before and after, or how they feel after they've done a relaxation, or what they look forward to? You know, what's the feedback that you get from children that you work with?
Yeah, it's interesting again, because as I said earlier, a lot of children's yoga is, you know, very much like play-based and high vibe and fun and activities. But if I ask at the end of class, what was your favorite part? I would say 9 times out of 10, they say the relaxation.
Yeah, I feel the same way. Yeah, absolutely.
Yeah, so a lot of children will say to me, oh, that's the most relaxed I've ever felt, or I feel so calm now. So they're really identifying the shift that's taken place in themselves, which is great, because then that eventually leads to emotional regulation, self-regulation, giving them that experience that, yes, this is how you can feel. This is possible for you to actually feel like this.
Yeah.
When I work with children on the spectrum, I can see like they're so tired because their body is working so hard. And I notice at the end of the session, some of those children might fall asleep during relaxation. And after the relaxation component, they will definitely, their face looks different. They look softer. They look like they're not darting around as much with their eyes. Yeah. They're more connected to their body again. They're more likely to come up and talk to me afterwards, whereas maybe before the class they didn't want to make any connection with me. Yeah. So I definitely see a difference in the connection. Sure. And definitely that ability to feel like their body, it's hard to explain. It's like they're back in their body again. When they've been out, it's this return back into their body. There's something that I see that they look more connected again.
Yeah, so it's like that sense of groundedness. They're a bit more grounded and not off in the rainbows and the stars. And their brain has got a million different images and thoughts fluttering around, and they don't know which one to choose and which one to ignore. They're just a little more grounded and connected to their body and a bit more stable. Yeah. And
that's
so,
a great analogy.
yeah, I just made it up. But I always imagine these stars and rainbows, you know, that they just can't figure out which one to grab onto. So with your experience, Stacey, what's the role of parents in all of this? You know, I find that we need to be consistent. You know, I can only see children once a week. So obviously within those other 6 days, then the child still needs consistency, the child still needs repetition. And for what you've just explained, for children to really embody the changes or realise that they feel differently based on one particular strategy, it needs to be repeated. So what, I guess, do you work with the parents as well, or what do you get from parents that helps them? What do you see as their role?
Yeah, excellent. In my teacher training, there's a whole component dedicated to the section called home. And that is to say that we can deliver these amazing sessions as children's yoga teachers, but unless we've got some way to integrate it back home, the child will then often think they can only feel this when they're with us, or they can only feel it when they're on their yoga mat. Yeah. And so brought up a really great point that there needs to be this integration back into home life as well. And yes, there will need to be communication with parents as to how they can facilitate that at home, and also to empower the children to be the ones to say, okay, it's bedtime and I need to do my belly breathing. Yeah. And so as we're teaching the techniques, we're encouraging the children and labeling it for them to say, this one is really good to help you when you feel cranky. And so next time you feel cranky, maybe you can try this particular breathing technique or this particular movement. Or, you know, this one's really good to help you if you have a tummy ache. So you could come into this pose and do some breathing when you've got a tummy ache. Or this one might be good to do in bed at nighttime. So as we're teaching it, we're actually embedding that into the child so that they relate that particular movement or breathing technique to something they can do at home. Yeah. And then, of course, we need to reinforce that with parents. And that might be with a little take-home piece of paper, something they can put on the fridge. It might be that the child is given a feather at the end of the session so that, and explain to the parents, like, this is how we do our feather breathing. So there's that connection with the parents. And the biggest tip I would say to therapists or children's yoga teachers or anyone working with children who are wanting to help get this work back into the home is we have to keep it simple. Because if we write this amazing Fangdangle program that's going to take half an hour every day, it just simply won't get done. Right. But if we can find really simple little golden nuggets that can be paired with other activities like a bedtime routine or like cleaning our teeth or getting ready for school, if we can pair something with something they already do so it doesn't feel like extra time, I feel like that's when it's going to be more likely to be practiced at home. Yeah, perfect. That's a very good reminder, is to really keep it simple. You know, children don't need complex or complicated. We're really trying to work from the most basic, you know, part of the brain, which is basic movements and basic things that come automatically to us, which is our breathing and which is our movement. So that's a really great reminder that we don't need to make it complicated. Yeah. And also for families, you know, parents already enough on their plate with trying to get the household organised and get everything ready for school and homework, etc. So it can be overwhelming for parents to add another thing to their plate as well. Yeah, that's right. And so with, I guess, if I was a parent, Stacey, and you know, I had a child that's experiencing some anger issues or some explosive behaviours or or anxiety, you know, what would be I guess your top method or an idea that you would suggest to me? What's something that a parent watching this would be able to go home and just start trying every day, maybe before bed or in the morning? What could be a little technique for them to use? Well, the first thing that springs to mind is giving them a healthy outlet for that feeling and that emotion and that expression, and acknowledging that that's okay for them to feel that in that moment. Because if we try and divert them too quickly back to the calm, then there is that squashing down, and it's probably going to come back later with a vengeance, with more intensity. So if it was, for example, anger, I would be giving, say, a wood chopper breath technique where they take their arms up like they're chopping wood and a really forceful exhale, which is really good at using up some of that angry energy. So I, again, would try and meet them where they're at and match the energy that they're wanting to express. If they're feeling really sad and closed off, I'd be finding a yoga pose like child's pose where they can curl up and hide their face from the world and take some deep breaths there. So matching them where they're at and then finding something that will calm them back into that parasympathetic nervous response again, or that calm response again. Definitely belly breathing. The more that that is practiced, the easier that's going to be accessed when they need it. I find that it's like, the analogy I use for parents and children, it's like riding a bike. When you first ride a bike, you might start with training wheels or a tricycle, and then you might have someone who's following you behind with their hands around your hips and helping you to stay balanced and on track. We don't send children off on a two-wheel bike onto the highway when they first learn to ride a bike. So if we are trying to teach calming techniques whilst they're in that stress response, it's like sending them out on a bike for the first time on the highway. We need to
That's a perfect analogy. That's really great. You're exactly
welcome to use that.
Yeah, amazing. Yeah.
So we need to be getting them some time on the tricycle or their training wheels by teaching them the calm techniques whilst they're already calm.
Yeah.
So that when they really need it, they know how to do it. It's not the first time they're learning it. So definitely at bedtime, getting a toy or something with a little bit of weight that they can place on their tummy so they can feel it in their body, and practicing that when they breathe in, their belly rises up, and when they breathe out, their belly relaxes down. I think that is the most simple technique that can help most children when they need it.
Yeah. Perfect. Love that analogy. That's a perfect explanation, what we need to focus on. And so I've had quite a few people come to me, Stacey, about wanting to do yoga teacher training and learn how to do it for themselves, as work, or indeed for their own children, so how they can do it. So would you like to share where you do your yoga teacher training and what it involves for people that are interested?
Yeah, absolutely. And there definitely are a lot of people who do the training not with the intention to go off and teach other children or in schools, but certainly their own children or a group of friends that may have similar experiences where the parents have pulled together and they want to create resources with each other. So that is definitely available in my training. You do not have to be a yoga teacher before you do the training. However, if you are going to go on to be a registered children's yoga teacher, then you first must be a level 1 yoga teacher, and children's yoga is a specialty area. So I just want to flag that it is open to people to do the training, but what you can do with it after the training is going to then be decided by your other experiences or qualifications.
Sure. Mm-hmm.
So this year I'm actually travelling around Australia. So I've just come back from Auckland in New Zealand. I'm running some trainings on the Sunshine Coast where I live. I've also got a training in Brisbane it's this month now. We're in April already.
There we are.
So at the end of this month, there's a training in Brisbane. And then throughout the year, I'll be going to Sydney and then up to North Queensland as well. So there are places, depending on where your audience is based, there'll be different places around that they can access me. The first step of the training is a 3-day module. So it's done on a Friday, Saturday, Sunday. They are full days. And in those 3 days, we uncover some of the anatomical considerations for children and how that's different to adults. We look at their development and learning. We look at ways to manage the classroom. And then, of course, we go through a lot of techniques with movement, breathing, relaxation. And the final day is then when I give out a lesson plan template so that the participants of the training can then have something that feels solid and yet be able to plug in their own creativity and be able to meet the needs of the children they're working with. So it's a template, but it's not stuck so that there is that movement to tailor it to make it more individual.
Mm-hmm.
After those 3 days, then participants can do other modules. And so one of the other modules that I think is probably most appropriate for this audience is the one that's called Yoga for Special Needs.
Mm-hmm.
And that's a 2-day training. And so in that training, we work through lesson plans that would be suitable for children on the spectrum or with ADHD, with compromised breathing like asthma, diabetes, eating disorders, digestion issues.
Mm-hmm.
And again, that's a really empowering training because we're using yoga then as more therapeutic rather than play-based.
Yeah, perfect. And if people want to find out more, Stacey, or get in contact with you, what's the best way for them to do that?
My website is inspiredkidsyoga.com.au, and all of the information about trainings is there, and links to my email is there as well.
Perfect, thank you. And Stacey, is there anything that we haven't covered today that you think is really important to share, or to have parents know? Anything that you feel like that you need to share before we close up today?
I feel like we've covered a lot in one conversation. I feel it's just good to reiterate that point to parents that you're not alone, that other people are experiencing what you're experiencing, and there is a community of support, and you're doing a great job, Jessica, of creating this community so that people can tap into that and get ideas and share resources and reach out to each other. So well done to you for that.
Thank you.
And I feel it's important for parents to be able to know that there are tools that they can learn to help their children, and to constantly remind their child that it's okay. I think, those 2 words, it's okay, and the other 2 words, you're safe, are really powerful words that we can say to children to let them know that what they're experiencing is okay, and we're supporting them in it.
Yeah, absolutely, because that really will follow into adulthood, knowing that everything we experience is okay. Even as adults, we tend to run from these scary feelings and sensations, and if we can teach our children from a young age that it really is okay, these feelings will pass, but you are safe right here and right now, and you have me to lean on and depend on and co-regulate with you and support you through this, then that really is the key to guiding these children and to become resilient and confident and self-expressed and not so afraid of those emotions when they come up, because they will come up for the rest of their little lives and adult lives. So that's really important. Thanks for sharing that, Stacey.
Yeah, I agree 100% with what you just said.
Yeah. Okay, well, we're all done. So thank you so much for sharing an amazing amount of information and what you experience. And for those of you interested in the teacher training or anything else, any questions that you might have of Stacey from what she has said, then you've got her website there. If you are in the Brisbane area and you're interested in contacting me for any reason, there's workshops, there's coaching groups that I run, there's one-on-one sessions that I do for trauma and special needs as well. So we're both here to help, and we're both here to support you. So get in contact with us if that's what you feel you need to do. But thank you for joining us, and thank you, Stacey.
Thank you so much, Jessica. Keep up the great work.
Yeah, you too. Thank you. Bye.
Bye.